Welcome to Breathing for Health. In this class, we like to work on three fundamental aspects of breathing, really our everyday breathing. It's going to improve our overall health and performance in life. That's for one, breathing through the nose, breathing lower using our diaphragm, as opposed to our secondary respiratory muscles, and breathing slower. What we're trying to do here is make our breathing more efficient, help use it to keep us in a calm state. One of the things that a lot of people don't understand about breathing is it's not the desire, the urge for oxygen that causes us to breathe. What it is it's carbon dioxide rising in our system. We have chemoreceptors, baroreceptors that are monitoring the levels of carbon dioxide. And what can happen is if we breathe through the mouth all day long, we spend a lot of time talking, we're inefficient in breathing, we blow off too much carbon dioxide. And we need that carbon dioxide to offload oxygen into our tissues, into our brain. That's why if you speak a lot, if you're talking all day or you have meetings, you might feel a little tired or lethargic after that. And part of that is because as you blow off so much carbon dioxide speaking, you are actually constricting the blood vessels and airways. You're not getting as much blood flow to your brain. And so these techniques are a great thing to come back to between sessions. And what I work with my one-on-one clients a lot, what we call the transitions in your day. So as you move between home to the office, between meetings, from the office to home, it's great to check in with your breathing and really focus on slowing it down. And that's the first session we're going to do. So we start with a nice breathing session, then we'll do some work to open up the rib cage and get our diaphragm working properly. And we'll end with a session of some smaller breath holds, working on building up our tolerance to carbon dioxide. And as we build that tolerance, we make the oxygen use more efficient, which allows every muscle, every system, our heart, everything to work a little easier during the day. Also can lead to a little bit of stress and a little bit less stress and anxiety in our lives. So as we start, I want you just to sit up nice and tall. And we're going to roll the shoulders down and back. Place our feet into the ground, just connecting with the earth. I want you just to begin to check in and notice how you're breathing here. Where do you feel it going? Is it in your chest, in your belly? Is it fast or is it slow? Notice any dominant thoughts in your mind. Any tension in the body, any emotions that also just maybe coming up right now. We're just checking in, creating awareness, not judging. Now I want you to begin to breathe a little bit slower than you were. Just on your own here. Closing the mouth if you're breathing in and out of your mouth. Breathing in through the nose. Letting the belly and ribs expand as you breathe in and let them fall as you breathe out. And gradually begin to slow down your breath. So wherever you are, I want you to exhale your air. We're going to breathe in for 4, 3, 2, 1. Pause. Out for 4, 3, 2, 1. Pause. In for 4, 3, 2, 1. Pause. And out for 4, 3, 2, 1. Pause. In for 4, 2, 1, pause. And out for 4, 2, 1, pause. In for 4, 2, 1, pause. And out for 4, 2, 1. Let's go in for 5, 4, 3, 2, 1, pause. Out for 5, 2, 1, pause. In for 5, 2, 1, pause. And out for 5, 3, 2, 1, pause. In for 5, 2, 1, pause. Out for 5, 2, 1, pause. In for 5, 2, 1, pause. And out for 5, 2, 1, pause. In for 5, 2, 1, pause. And out for 5, 2, 1, pause. And we're going to go in for 6, 2, 1, pause. Out for 6, 3, 2, 1, pause. Breathe in for 6, 3, 2, 1, pause. Breathe out for 6, 3, 2, 1, pause. In for 6, 3, 2, 1, pause. And out for 6, 3, 2, 1, and pause. Continue that on your own. In for 6, pause, out for 6, and pause. You breathe in, making sure you pull the breath down into the belly, letting the belly and ribs expand. As you breathe out, letting them fall. Just like to use those pauses in the breath, the space between the breath, as we like to call it. No reason to rush on to the next breath. So often rush on to everything in our life. Can you be control, calm in that space? So we're going to do this for 1 more minute. And now just let the breath go back natural, relaxed into the body. Just letting it flow where it wants to flow, move where it wants to move. And notice any subtle shifts. In the pace and speed of your breath. Maybe in those thoughts in your head or any tension in the body. You can open your eyes whenever you're ready. Nice. Now we're going to move on and do a couple of drills to work on the diaphragm, improving our diaphragm function. First, I'd like everybody to give me a big deep breath. All right, so one of the first things I notice, I always see this with people, is don't take a big deep breath. Where do we go? We go up vertical, raise the shoulders towards the ears. So what we're doing there is we are using these secondary respiratory muscles, our neck, our shoulders. If you have a lot of tension there, good chance that you're breathing that way all day long. So what we want to focus on is pulling the breath and breathing horizontally, really 360. You see my ribs trace out right here. Diaphragm sits like a nice little parachute. As you breathe in, it flattens out. Ribs lift up like little bucket handles. Intra-abdominal pressure pushes down, helps massage your internal organs, pump lymphatic fluid, helps naturally detoxify the system. Also helps activate that more rest relaxation side of the nervous system, the parasympathetic side. Breathing in that vertical fashion, we're causing ourselves to induce some more sympathetic, more stress side. We are releasing more stress hormones like cortisol, adrenaline. Our body believes it's in a fight at that point. It needs to create some action because there's a perceived threat if it's really having to use these muscles to breathe. So first off, we're going to do a little test. We're going to go through some stretches, help open everything up, and then we're going to retest. So I want you just to sit up nice and straight. We call this Superman breathing here. So my hands are at my low ribs. So you should feel your ribs with your fingers. This, oh, see my thumb is pressed into my back here. And I want you to give me just 5 slow breaths. So as you can watch me on this first one, as I breathe in, I'm breathing into my hands. As I breathe out, my hands are coming in. You can help guide yourself. We want expansion on the inhale, narrowing on the exhale. Just give me 5 slow breaths and then drop your hands. Slowly in through the nose, slowly out. All right. Might felt a little difficult at first. It can be very challenging when you first start using this pattern and focus on breathing in that lateral 360-degree fashion. You might not really felt any movement at all, and just continue to feel the shoulder, and that's okay. This is a good drill to practice in front of a mirror so you can notice how you're breathing. What we're going to do here is just get the diaphragm activated. What can happen if you're sitting a lot during the day, you can kind of get stuck in more of a partial inhale position where it's just kind of sitting here flat, and we're going to work to get it back into its natural resting position and just get it fired up. So we want to take our fingers, we're going to rub them just down our sternum, in through the nose, out through the nose. We've got some activation points, some pressure points right here on our sternum that will get the diaphragm moving. Then we're going to trace out our ribs. And we're just going to take our fingers, and this is a little myofascial relief self-massage to the diaphragm. We're just taking it. You see as I'm digging up under my ribs, this might be painful. Don't want you to push too hard on the pain. But find some spots that kind of stick. So as you find those, you're just going to breathe in. And you can exhale out of the mouth. Try to get a little bit deeper. We're just going to find a few of those spaces. We'll drop our hands. So one of the things that can happen is the older we get, really starting 29, 30 years old, our ribs become more like a cage, our thoracic region. It doesn't want to move as much. So we really want to open up with it. You can feel, you push your fingers in your ribs, that tissue, that space between the intercostals muscles, those help us with breathing. And we want those things to be able to move. So we like to do a few stretches to help get that stuff mobilized. If you sit a lot, these are really great to do every day. So the first one, we're just going to spend about a minute here. And what I want you to do, we're going to breathe in for a count of 3. You can take your hand, hold it on your ribs like I am so you can feel it. When you get to the top, just holding on, feeling that expansion, and then exhale for a count of 6. You can go in out of the nose or the mouth. Maybe you get a little bit deeper. There you go. Good job. Keep going. Do about 60 to 90 seconds. So in 3, hold 3, out 6. Really focus on getting a nice deep stretch. Good job. Go for about 30 more seconds on this side, and we'll move to the other side. And let's take it up and over on the other side. Same thing. Using our opposite hand to give us some tactical feedback. As you breathe in, really can you feel that expansion going on in the ribs? As you breathe out, you get a little bit deeper. Good job. 60 to 90 seconds here is good. It helps open everything up for us. Go for 15 more seconds on this side. Good. And we just come back to center. Now we're just gonna do a little seated twist. So here I'm grabbing on the side of my chair. You can use your leg if you'd like. And we're gonna do that same breathing pattern. In for 3. Just focus on breathing down to the belly, expanding the ribs, holding for 3, and then out for 6. Somewhat restricting our breathing here with this twist. So just noticing the difference, how it feels. You can just keep your head same position with your torso, just moving straight, looking to the side. Maybe use a slight bit of more engagement here, so pulling your belly button into the spine, engaging the core as you exhale. Go about 10 more seconds on this side. And let's take it up and over to the other side. Good job. In 3, hold 3, out 6. And then we're going to come back to center and just do a nice little retest. So hands low rib area. Close your eyes, shoulders down and back, and just begin 5 slow breaths, breathing into those hands, letting the hands expand as you breathe in. And narrow as you breathe out. I want you to check in, notice any differences you might feel. Maybe you feel a slight bit more expansion. Maybe you don't feel anything. After you're done with those 5 breaths, you can just come back, hands in your lap. We're going to finish off with some breath holds. These static breath holds are a great way to build that CO2 tolerance, but also build a little resilience in our mind and our body. And let us become aware of those thoughts and triggers that pop up in our head is our body's number one goal is respiration, the need to breathe. So when we begin to hold our breath, it can cause us some slight stress, especially if we're not used to it. So noticing the stories you begin to tell yourself, can you relax into it, let go? You're completely safe. You're under control here and you're in charge. So if it gets too difficult on any of these holds, I want you just to take 1 breath and see if you can split it up into 2. What we're going to do is we're going to breathe for a minute. Then we're going to go through a rounds of breath holds on the inhale. So we're going to go 15-second hold, and we're going to breathe for 15 seconds. We're going to go 20, 10, 25, 5. Then we're going to go back down to 15 and then do a longer breath hold of 30 seconds. We're going to breathe and we're going to go through that same thing on the exhale. So notice the difference in feelings here. We're going to end it out with just a few minutes of one of my favorite patterns, great introductory breath pattern called box breathing. So if you'd like, you can do this seated or lying down. It's really up to you. Go ahead and begin to breathe in through the nose, out through the nose. We're just going to let our breath flow here for a minute. You can use nice balanced breath in through the nose and out. Just use that same little sequence we did at the beginning. Maybe you go in 4, pause, out 4, pause. Whatever you feel like you need right now. All right, we're going to do our first hold in about 20 seconds here. We are holding in 10. Holding in 5, 3, 2, 1. Take a breath in and hold. 15-second hold. We're going to keep our face relaxed and we're going to keep our jaw nice and loose, lips closed. We've got 3, 2, 1, and we just breathe 15 seconds. No need to take big giant breaths, just a nice, natural, easy breath in and out. And we're holding in 5, 3, 2, 1. Take a breath in and hold 20 seconds here. Keep the shoulders relaxed. Got plenty of air. 3, 2, 1, and recover. And we're holding in 3, 2, 1, and hold. Not a lot of time on that recovery. Keep holding. You got 5 seconds. 3, 2, 1, and recover. Only 5 seconds to recover. Quick breath in, out, and we're going to hold again. Holding on the inhale. Got plenty of air. You only got 5 more seconds. And recover. 10 seconds to recover. And hold. Only holding for 15 seconds this round. And recover. Remember, do a 15-second recovery, and then we're going to go a 30-second hold. We're holding in 3, 2, 1, breath in and hold. Nice, relaxed hold. Keep holding. You got 10 seconds. Notice that trigger, those alarm bells might be going off. You've got 5, 3, 2, 1, and let go and breathe for a minute. Spend a minute to recover here. Now, as we go through these holds on the exhale, I want you to notice if they feel any different. Maybe they're easier, maybe they're harder, we're all a little different. Can you stay calm and cool in the midst of that urge for air? Helps like to come back to a mantra. Maybe it's something like easy day or just let go. That's something that allows you to sit in the stillness. We're doing our first exhale hold in 15 seconds. We got 10. 5, 3, 2, 1. Exhale your air and hold. Keep holding. You got 5, 4, 3, 2, 1, and nice smooth recovery breath. We're holding in 10. 5, 3, 2, 1. Exhale and hold. 20 seconds here. Keep holding. You've got 5, 3, 2, 1, and recover. Only 10 seconds to recover. We're back at it. In 5, 3, 2, 1. Exhale and hold. The shoulders relax. Relax the space between the brow. Relax your jaw, your eyes. Brain might be telling you need to breathe, but you don't need to. You've got this. Only 5 seconds left. And recover. Quick recovery, and then we're holding again in 3, 2, 1. Exhale and hold. Keep holding 10 more seconds. You got 5, 3, 2, 1, and recover. Holding it in 5, 3, 2, 1. Exhale and hold. 15 seconds. You got 5, 3, 2, 1. You got 15 seconds to recover. We got one more hold on the exhale. 5, 3, 2, 1. Exhale your air and hold. "30 seconds. Be calm in this space. You're in control. You've got more air than you think you do. Keep holding. Five, 3, 2, 1. And we're just going to spend a minute breathing here, just letting it flow naturally in and out. Now, what difference did you notice there? Just make a mental note. Was it easier? Was it harder? Did it stress you out? Maybe those holds were very relaxing for you. About 30 seconds, we're going to go through box breathing. It's a great technique to use whenever you need just a little calm and space. We're going to breathe in, we're going to hold, we're going to breathe out, we're going to hold all for the same amount of time. It's not going to be long. Just going to do 4 seconds at first and let you go on if you want more. So go ahead, let's exhale your air. We're going to breathe in for 4, 3, 2, 1. Hold for 4, 3, 2, 1. Out for 4, 3, 2, 1. And hold for 4, 3, 2. In for 4, 2, 1. Hold for 4, 2, 1. Out for 4, 2, 1. And hold for 4, 3, 2, 1. In for 4, 2, 1. Hold for 4, 2, 1. Out for 4, 2, 1. And hold for 4, 3, 2. In for 4, 2, 1. Hold for 4, 3, 2, 1. Out for 4, 2, 1. And hold for 4, 3, 2. If you continue that on your own, in 4, hold 4, out 4, and hold 4. Just following the breath and letting everything else go. Here, we're not really focusing on taking big, full breaths, but just natural breaths. So we breathe in, letting the belly expand, holding the breath at the top and feeling that expansion. Letting the belly fall as we breathe out, and just sitting in that space between the breath. If you'd like, you can slow it down even more. In 5, hold 5, out 5. Maybe it's a little too slow and you need to go in 3, hold 3, out. You can do this for 1 more minute, so just do whatever you need. Now just letting the breath flow back natural, relaxed into the body. Letting it move how it wants to move, checking in, noticing any subtle shifts we might feel on our breath rate, our mind, our body, our emotional state. Use the breath for a lot. Improve our health, performance, decrease our stress levels. It's a tool that we all have. Most of us haven't been taught. It's one that will always be with you. You can always come back to it. You can continue breathing like this as long as you like. If you are watching this video, you can send me an email. You got any questions on anything, and I will stop it here and answer any questions for those who are live. I hope you guys have a great day.